Hello everyone and welcome to my channel. Of recent, there have been quite a lot of K-dramas that focus on mental sickness, be it bad and crazy, the whale, mad for each other, etc. Among these, the term hypnosis caught my attention. As per Wikipedia, hypnosis is a trance-like state in which you have heightened focus and concentration. Hypnosis is usually done with the help of a therapist using verbal repetition and mental images. So, I quickly happened to connect with the hypnotherapist to hear from him. The following is a telephonic conversation that I had with Dr. Mukunth Srinivasan, a certified hypnotherapist from India who has a decade of experience. Hope this gives you an idea about hypnosis and what all it covers. Please note, this content which you are about to hear is purely for information or educational purpose only and does not substitute professional medical advice or consultation with healthcare professionals. Hello, Dr. Mukunth. This is Mona, YouTuber. Can I go ahead and talk to you regarding the email that I sent across to you?
Hi Mona, how has your day been?
Yeah, it's been fantastic, Mukunth.
You had raised some questions regarding hypnosis and the facts of it. So yeah, let me know what you need to know.
See, doctor, this is regarding hypnosis. I just wanted to know how hypnosis works in the medical field as such.
As a hypnosis approach on the medical field is quite vast. It's been huge. It's been around for quite some years, and the field has been completely explored as such. And so, if I have to give you an overview of it, majority of the issues that's been handled is on the subconscious mind. You address the body in the medical field through the body. So you take injections, you take pills, and you take, the care the body needs so that the body rejuvenates itself. In the field of hypnosis, you address the same issues, but you address it through the doors of the mind. So what happens is you address the mind, you sort the problem out. So does that help?
Okay, fine. I kind of got an overview of what you're trying, what I wanted to know actually. And I just wanted to know, can hypnosis be done over phone or is it really required to be in person?
Well, hypnosis is not required to be in person. It can be done over the phone. Most of the cases today, even fertility for that matter, and every other case has been handled over the phones. But there are some cases, like for example, when you start to work with transgenders, it's better that you have a face-to-face or an in-person session. But anything that's not on the higher scale, it works very well on the phones.
Okay, fine, fine. So, and I just wanted to know, is there any specific age group in which you can do this hypnosis? It works on
See, hypnosis
specifically.
works on the mind. You're addressing a person through the mind.
Okay.
On a statistical way to look forward is a lady becomes an adult after she hits a puberty, and more or less the same age for the guys. So about 13 to 15 is when you can work on a person directly. Until upon them, it's better to work through their parents or through their guardians or to their godfathers, whomever is available to handle them.
Okay. Okay, fine. So how effective is this hypnosis when you do to a person?
Hypnosis is very effective. The one good reason is it's got no side effects because you're not giving any external supplements on a person, so there are no side effects to it.
Okay.
And so the recovery rate, for example, some ailments demand one session. Most of the ailments demand one session or two sessions, but some of them, for example, the skin disease like psoriasis demands about 5 sessions. So
Okay.
the recovery rate is about 4 to 5.5, 6 months. It depends on the person and the individual immunity to regenerate their cell growth and stuff like that. So you cannot generally give a number, but this is the statistics that we have.
So are you telling me that hypnosis can cure all kinds of diseases, both mental as well as physical?
As long as the person is in a conversational state, because hypnosis, the person has to be able to converse. He or she should be able to talk out their problems to the concerned therapist. So when it is done, the problem gets resolved because that's the mode of operation. And as far as I have seen over the past decade of experience that I have, almost all the issues have been resolved by hypnosis. Unless and otherwise something is an emergency, you cannot do it because the client will not be in a position to communicate their feelings and they'll be in a condition of trauma. where we suggest them to go for medical help, as in the Western medicine, because that works even when a person is not able to communicate their ailments.
Okay. Fine. So, with you saying that, there are a lot of, physically as well as mentally that can be solved through hypnosis. Why is it still not popular among people as such?
Everything that's popular is economically feasible, economically affordable. Things that are
Okay.
not popular is always pricey. With
Okay.
hypnosis, it is always a one-on-one session. It is never, you don't have a market solution or a statistical approach or a probability way of looking forward on a problem. Every person is treated as an individual, and every issue gets resolved between 2 to 5 hours. It depends upon the person's willingness to open up. So if you look at it on a given any given scale, if you take a minimum for 2 hour session on a person, it's going to take about full scale, with all the intervals and stuff, about 10-hour job for 4 clients on a daily basis. So when you work face to face on a person, and very few people could only afford it back then. Now, since the number of hypnotherapists are also rising in numbers, a lot of people are able to afford it, and it works with them. And why we do face to face, I mean one on one, is primarily because every person has a different experience within the same situation. Given the same environment, some people get infected, some people don't get infected. So an individual's immunity has to be addressed to. If a person is suffering from something, obviously it means that particular corresponding immunity is not good enough to fight back. So it has to be worked on individually. That is one of the main reasons why hypnosis didn't see the popularity part of it. But yeah, it's quite famous in the field of alternate medicines.
In terms of the Western world, prevalent. I mean, it is more. What do you say? More advanced, or a lot of people know about it. But when it comes to India, the awareness is not much. How do you think you can bring about this kind of, awareness among people?
Uh, as long as people are willing to take time out and spend some time and to sit with them, relax and heal themselves, given about a week's time or something like that to, entirely rejuvenate a person in different scales, they will definitely be able to find out hypnosis. Not just hypnosis for that matter, any healing sciences. If you look at Reiki, it takes about 21 days. If you look at pranic healing, it takes about 21 days. If you take hypnosis, it takes a couple of hours. Then there is NLP, then there are so many other forms of crystal healing. Then all these other healing modalities are always there. And if for the matter of fact, hypnosis is an age-old Indian science which moved to the Western world. And from the Western world, it picked up momentum. Now it's coming back to the Indian world. So all these sciences do exist, does exist, and are prevalent within the Indian masses. Just that people are not able to find that kind of time to spend on a different form of medical science to experiment it. Maybe there's a lot of hiccups there. But in other countries where the population is lesser and people are willing to take out their time to fix up their issues, yeah, they are willing to do it. So that's the difference as far as I have seen.
Okay. Okay. So, and I just wanted to know, doctor, what kind of diseases, or mental trauma, or whatever kind of that can be solved through hypnosis?
Okay. So for this, I'll give you a different answer. Okay. I'll tell you what hypnosis is all about so that kind of answers your question. Hypnosis is all about picking your own ideas from within yourself.
Okay.
So if you're able, you're going on the road, it's traffic, and suddenly you get an idea for an alternate route. So you follow that route and you reach on time.
Okay.
Now, if you do not get that idea on time, what happens is you're stuck in traffic, then you go with the flow, then you move through. For
Okay.
example, you're making something on your kitchen, and all of a sudden you're not able to find that kind of ingredient that you're looking for. Is there an
Okay.
alternate that that your mind suggests, or is there an idea that you get? If you get, then you proceed with the recipe. But if you do not get, either you go ahead without the ingredient, or you go buy the ingredient and come back and finish the cooking. So what the fundamental aspect of all of us human beings is that for every problem we need an idea which brings the solution for the corresponding problem.
Okay.
Does that make sense? So
So,
be it for diabetes, be it for blocks in the heart, be it to get rid of smoking, be it to get rid of drinking, or to get rid of love, depressions, or be it to be the best student in your school, or be the best athlete who brings out the fastest time. Everything demands a certain amount of ideas. As long as the idea comes to you on time, you don't need an external help. But
Okay.
for some reason, different people, most people are not able to get these ideas from within them. So
Okay.
what we as hypnotherapists do is we learn, we ask the client what their problem is, what they're going through, and when the problem comes to them, the intervals of it and stuff like that. And we take them into their own subconscious mind. We guide them so that they are able to get into their subconscious and pick their own ideas. So
Okay.
these ideas are very, very individual. One idea of one person does not go well with the other person. So this idea, for example, if you have a problem, you enter your subconscious mind, you get your idea, you come back, and you will be able to easily implement it just because it's your own idea, right?
Yeah.
And now that you know how hypnosis works, let's say you have a pain in your knees or in your ankle, or is there is a slip disc issue, or is there a spondylitis issue, or you're wearing eyeglasses, or is there a thyroid issue. Any of this is a physical problem. All that you need is an idea to get rid of it. Or for the reasons of mental, if you're going through isolation or disrespectful or rejections, or for that matter, you're not getting paid the kind of pay that you need to get, your work is not getting recognized, all that demands an idea so that your work gets recognized, so that you get recognized. If somebody is not getting married, so that they need to have their own recognition. So everything boils down to an idea that comes from your own self. So as a hypnotherapist, none of us give any ideas for the as point one. We don't give any suggestions, we don't give any advices, we don't do any counseling. Psychologists do the counseling, they're good at it. But hypnotherapists, none of us give any ideas, suggestions, counseling, advices, nothing of sorts. We just help people to pick their own ideas from their own subconscious mind so that it benefits them.
Okay. Doctor, there is a general fear, about the confidentiality or, things like that, in with regard to either face-to-face meeting
Yes.
or over phone. So, how do you think you can address those kind of fears among the people,
Yeah,
who want to?
anonymity when it comes to any sort of therapy, be it psychology, be it hypnosis, or any side, it's always been there. And I work
Okay.
with so many people in the film industry, so I always face it. So the one of the things that we tell all of our clients is we really don't need, we don't need to know your name or your background or whatever it is.
Okay.
If you're okay to tell your name, because most of the names are common names. There is no, for example, your name is Mona, there are so many people with the same name, and some of them could be big time celebrities. So
Okay.
even if anybody is calling me and if they're giving me their name, I'm going to just take believe that's their name, right? So previously we used to do it face to face, and yeah, people had confidentiality questions, and we used to tell them, see, this is a profession, we don't really bother much about who you are and where you come from and what your profession is. So you have to trust us. Every business is built on trust, and these
Okay.
days we do it on phones. If somebody is requesting for a complete audio call and not a video call, we respect their views as well. So it's basically trust. You just have to go and trust your therapist. And yes,
Okay.
the only
So,
way you can expect confidentiality is by trusting each other, right? So yeah.
okay, fine. So, in one K drama as such, I know this is with regard to a movie, a full drama which is fully fictional. The thing is, a hypnotherapist actually, records the session of the client so that he can, study over it or replay and things like that. So, I mean, what do your take on that actually?
The documentation, most of the Indian doctors don't do for
Okay.
obvious reasons, because Indian ethics as such. If you go to any doctor these days, and if you look at any of the Indian hospitals, the last 10-15 years with the digital makeover within the hospitals, people have started taking down names and numbers of their patients to keep a record of them. But previously, if you go back 20 years, 15 years, with not much of computers into the market, people never hardly took names of the patients, hardly took any numbers, or any follow-up sessions were all, none of which was followed. It was like the patients who used to walk into a hospital, walk into a clinic, and they would tell their problems and get the solution, walk off. So that's how it is. But as such, if you look at the other side of the spectrum, when people are budding hypnotherapists or budding any sort of doctors, they need to have some sort of documented proofs to understand how a therapist works with a client, and they get a perspective of how different issues have been resolved. So if a client is willing to to have their session with recorded
Okay.
and be used for medical studies, then okay, that is acceptable, I believe, because the client is willing to adhere to such terms. But if the client is like, no, no, let you just keep my conversation within ourselves, and I don't want to have my conversation recorded or for the purpose of medical, then yeah, that can be respected as well, because there are a lot of people who would favor documentation, and some people wouldn't favor documentation. That's okay, I guess.
Okay, fine. That sounds fine actually. So that's all that I have in mind right now. So I'll be posting this video on the net, I mean on YouTube. And apart from that, I will given a, are you okay with me sharing your name and your contact details just in case someone wants to, contact you further, or just in case if they have any queries as such, I can call you back and just ask in future. Is it okay with you?
You can definitely share my name and you can give them my email address, but with the phone numbers, you understand, right? Because
Yeah.
it wouldn't be feasible for me to pick the call if somebody is calling me on a particular time and I'm having a session or something. So if they drop me a mail, then I'll be very well to give them a call back. We
Okay.
can have a scheduled talk and such like that. So I have no issues regarding that. And a big hi to all of your YouTube fans and community.
Okay, fine. Thank you so much, Dr. Mukunth, for your time, and uh, hope to have another session with you based on the comments and feedback from my YouTube family as such. So it was actually nice talking to you. I had a little bit, some knowledge about what hypnosis is all about, and it is a little bit different, or you should say, from what I see from the movies and what is actually the real truth. And it's not always true what we see in movies as such. So this kind of gave me a this session kind of gave me a little bit insight of what hypnotherapy and hypnosis is all about, and what kind of mental or physical illness it can solve, and what age group it can reach about, and some of the things that can be documented or not. So it was a little bit for a layman like me, it was a bit clear, the way you explained in terms of traffic signals and the kitchen ingredients. So it was actually wonderful talking to you, and I hope to meet you and talk to you in future. So thank you so much for your time, and would definitely connect with you in future. Thanks, Dr.
Pleasure is mine,
Mukund.
Mona. Nice
Yeah.
talking to you.
Thank you. Bye.
This, we come to this end of this video. If anyone you know is in need of help and want to contact Dr. Mukunth Srinivasan, I will leave his details in the description below. Hope this video was helpful. If you liked this video, please click on like, share and subscribe, and don't forget to click on the bell icon. Don't forget to share this video with your family and friends who are in need of help. I'll be back soon with another unique and interesting video. Until then, stay safe and stay healthy. Bye.